Hi, Namaste, Jai Shri Mataji. I am Dr. Anoop. Today, I would like to share my experience related to a topic. Before I begin, I apologize to all my brothers and sisters inside yoga for not doing video for almost 4 to 5 months. I was very much busy with my work schedules. I used to work for say more than 8 hours or 12 hours, so because of that, I did not have much time to spend to do videos on Saj Yoga. But now I would wish to do this video sincerely related to a topic which I usually never discuss with people, neither within Saj Yoga or also outside Saj Yoga, which is how to handle a situation when you have a chest issue like chest pain or chest tightness. The reason why I never used to do a content based on this or never used to share with people much based on this is because I do not want to mislead people, and me being an MBBS doctor, it's my duty to not spread wrong message at the same time spread the right message. So uh, I hereby wish to convey few things. First and foremost, before I start speaking about this, and while you're watching this video, please make sure that this video is not being done to follow as per what I say. I'm not going to do anything or show anything in this video, but I would like to convey few things how should be basically the approach so that each one of you will get an idea about one's own human body and how to handle not just a chest pain, most of the pains you can handle if you use this technique. Now in Sahaja Yoga we have a beautiful method to find out which chakra catches when we close our eyes and when we meditate. If we practice more into this, we can spontaneously know which chakra catches, and when we do the clearance, the root cause will be solved and the primary issue is almost sorted, and you will recover completely from any health ailments. Now, how to continue this and how to practice this and how to maintain this is something which is very important. Make sure do not break the schedule of a regular meditation if you're doing meditation for long, and if you skip for maybe 1 week is okay, but more than 2 weeks, 3 weeks, 1 month and all means, see, this is actually a stitched system. When you do meditation, you are developing, just like how you go to a gym and when you do muscle workouts, your muscles are developed, your muscles get stronger, your muscles get enlarged, so muscles grow. Sorry. So all this is a continuous practice with dedication, systematicity, regular routine, discipline, everything. Same way, meditation also will cause so many developments within your body, especially your immune system. Your autonomous nervous system, as you do day by day, will start getting stronger, and it is the power of this autonomous nervous system which you are using to cure most of the health conditions. So, my request to all of you is to understand what happens in the body when you get a pain. But most of the reason why we are not able to handle pain is because we may be suffering from it deeply, and we may lose our patience. We don't have time to think, and we are taught from books, from different sources, from Google, artificial intelligence, from people, from doctors. So as a result of this, we have mixed something inside our mind and kept it such a way that this and so is supposed to occur when so and so happens. As we have seen ancient in scriptures, Adi Shankaracharya has told, borrowed wisdom will never bring you to your ultimate state. Whatever we have studied, whatever we have learned is all from what we see from people, what we read through books, what we see through television, or what we hear from people. It's not through our experience. Though we may correlate it with our experience, it's again a mental projection. We make ourselves believe that we have experienced ourselves. It is actually delusional to believe that we have experienced what we read from books or it's ultimately you have to do it by yourself. Why I'm sharing this is because I am a person who mostly get so many health issues, and for the past almost 5 to 6 years I have not been taking any medications. And now I am deeply into Sahaj meditation and Sahaj techniques and Sahaj teachings, such a way that I find out myself through meditation how each and every health conditions can be managed. It's at the end you have to manage, heal, manage, and make yourself comfortable. That's where the recovery will happen. Otherwise, it is not easy enough to just say manually or just to take a medicine. It's easy, but after all, it's the chemical which is acting inside the body and causing all those healing and treatment and everything. But tomorrow, if there is no medicine and if there is no place nearby, still we have to know what are the natural remedies, natural methods, how we can cure ourselves. Again, this video is not meant to cure chest pain without going to hospitals. No, if you are not aware about your own body, how the body mechanism works out, and if you are less tolerant to pain, and if you are very much upset, desperate, embarrassed, and frightened, it's always better to go to hospital. Unless and until, except if there is a very strong Sahaj yogi who is close to you, who knows to do all this healing and chakra clearance, everything. Or if you have a Sahaj center or any doctors working in Sahaj or anyone who knows more about this, it's always better to go there. If you are nearby, you can go there directly if it's not that emergency, or else it's always advisable to go to hospitals or treat it, find out at least what exactly is the problem, get an admission, and when you come back, it's your own choice whether you need to take medicine or not to take medicine. But prevention is always better than cure, because if something left untreated, if it's fatal, it's not right to keep it till the last moment. I used to face many times chest tightness and chest pain. Even recently, few days back also I had this same issue. So I would like to share what chest pain exactly is, what are the reasons, root cause. There are many types of chest tightness. Okay, chest pain itself is not a disease, it's a symptom. Just like headache. Headache cannot be called a disease, but migraine is a disease. Even migraine can be considered as a symptom. But if it enters into some other condition like stroke or something like heart attack, then it is called a disease condition. Other than that, whatever we see, pain or any feeling or sensation cannot be considered as a disease. Increase in sugar is not a disease, but diabetes mellitus is a disease. First, we should learn to figure out and understand between both of them. So, whenever you have a chest pain, it's not always that it can affect the heart, cause heart failure or heart attack, but there are many reasons that have chances to enter into a complication and cause heart attack or heart problems. This is more important to understand because chest tightness or chest irritation or chest pricking sensation or chest heaviness, there are different types of pains which people address in hospitals. We all face that, so we need to know what type of the pain it is. If it's on and off, on and off means if it comes and goes, if it's random, if it is on taking rest, or if it's happening during a slight movement. All these are the factors which will predict what is your decision and what is your judgment. Based on that, you have to make quick remedies. Any pain or most of the pains are happening as a result of acidity and gas related issues, which will cause something like heaviness or tightness. Sometimes you may not be able to breathe, so you will have a deep pain on the chest. This same pain also happens when you have a lung related issue for people who have chronic cough. So it's not easy to figure out what exactly is the reason, but it's easy for oneself, for each and every human to know what are his lifestyles, what are his eating habits, where are the problems, so that he can know exactly what exactly is the reason for his own cause for a particular health issue. No matter it's even a chest pain, headache, for every condition, this is the principle you have to follow. It's not just one common cause or reason for any condition. Even a common cold can be caused due to many reasons. So there are different types of chest pain: acid related, acid reflux, acidity related, lung related. And if there is high sugar, high cholesterol, no body activity, always leading a sedentary lifestyle, less sleep, high blood pressure, this can cause heart issues, which will gradually it will reduce the wiring of the heart and cause heart attack, which can even cause massive shooting chest pain. Even chest pain can be caused if you lift heavy weights, if you're not moving your body, if you're going to a gym, if you're starting weight training. It's called costochondritis, spasm or spasmodic cardiac muscles, which causes heart pain, chest pain. This is again, the chest pain and the heart pain is different. Chest is here, but heart is here. We have two hearts as per Surgery Yoga, left and the right. So if right is there, it will gradually come to the left. If left is there, that's why you have to clear your right side. And sometimes Muladhara chakra also you have to clear in case of chest pain. Sometimes you have to clear your left Vishuddhi. I am not going to tell a precise treatment or this is a confirmed treatment for chest pain. No, I will not say that. I want all of you to see this video and understand through meditation. Try to meditate and find out where exactly is the clearance. Practice it in the presence of sage yogis. And if they are not there, if you are confused, always go to a hospital. And if they are there, and if you want to practice, and if the pain is little achy, and if the person standing next to you is very confident in correcting the chakras, means you can use that method, or you can approach to any research center of Sage Yoga. Don't do anything by yourself without having an idea. I have been practicing my body for almost 8 to 10 years, and recently 3 years back only I started developing a deep faith into healing. So I'm not taking any medicines for any condition. I had a chest pain few days back and I cleared it only through bed rest, meditation, and now I'm able to even eat what all I used to eat before 2 days back properly. It's just when you rest your body, your endorphin hormones will be released, your stress will reduce, your parasympathetic nervous system will be more stronger. Those people who exercise may be not having an immediate recovery from chest pain, maybe within 1 or 2 days. Maybe some people who never do any exercise can have a massive recovery maybe within 24 hours. It depends from people to people. It's not in our hands. So this is my message to all of you. Please look at one's own health. Take care of it. Jai Shri Mataji. Thank you all. Thank you.